Thank you. You may be seated. The Secretary shall read the fifth order of the day.
Order number 5, Policy and Budget Speech on Vote 10, Department of Health.
I now call upon the MEC for Health, Honorable S.J. Manzini, to deliver the policy and budget speech.
Madam Speaker of the Mpumalanga Provincial Legislature, Honorable MC Masilela, the Deputy Speaker, Honorable Sam Masango, the Premier of the Province, Honorable MP Ndlovu, my colleagues in the Executive Council, Chief Whip of the Majority Party, Honorable E.N. Makabane, Chairperson of the Portfolio Committee, Honorable M.N. Mhlongo, and members of the Committee on Health, members of the Mpumalanga Provincial Legislature, leader of the House of Traditional Leaders, Khoshi Mokoena, and other Bondabezi Tabakhona, executive mayors, MMCs, and all other councillors, Secretary of the Mpumalanga Provincial Legislature, Mr. H. Shabangu, DG of the MP Provincial Government, Ms. M. Skosana, Head of Department of Health, Dr. L.K. Ndlovu, and other heads of other provincial departments, traditional healthcare practitioner, developmental partners, organized labor, hospital and mental health review board, clinic committees, managers and officials of the Department of Health, people of Mpumalanga Province, and distinguished guests. Madam Speaker, the prestigious generation of men and women who gathered in Clifton to adopt the Freedom Charter exactly 70 years ago pronounced without any hesitation that, open quote, a preventive health scheme shall be run by the state, free medical care and hospitalization shall be provided for all, with special care for mothers and young children, close quote. Inspired by the pronouncement, the chief volunteer of the Defiance Campaign, which was the precursor of the Congress of the People, which adopted the Freedom Charter, President Nelson Mandela later made an eloquent argument that, open quote, health cannot be a question of income, it is a fundamental human right, close quote. Today we stand before the people of Mpumalanga to table the budget vote for the Department of Health for 2025-26 financial year in honor of the memory and visionary leadership of those who gathered in Clifton, like Prof. Z.K. Matthews, Ben Turok, Wilson Konko, and many others. We stand here to account for our part in pursuing their dream of providing free quality care for all, especially women and children. We provide this account because, like them, we fully appreciate that healthcare is not just a service. It is a constitutional right, a liberation promise, and a daily lifeline to millions. Most importantly, because of our commitment to the task President Oliver Tambo gave us through his message on Radio Freedom on the 22nd of July, 1985, when he said, our major task is to build the society visualized in the Freedom Charter. Madam Speaker, social scientists teach us that the future derived its existence from the womb of the present, and that all societies bear their imprint and birthmarks of their past. It will be offending the laws of science to assume or think that the evolution of healthcare provision in Mpumalanga does not have the birthmark of South African unjust past. This is a past where the public health sector was marked by disparities in health services between blacks and whites and rural and urban during the time of apartheid. An example is that in 1981, there was one doctor for every 330 white, but only one for every 91,000 blacks. Infant mortality was 20% in the black population compared to 2.7% in the white population. The life expectancy in 1980 was 55 years for blacks, 58 years for colored, 65 years for Asians, and 70 years for whites. The incidence per 100,000 of tuberculosis in 1985 was 211 for blacks, 429 for colored, 80 for Asians, and 18 for whites. But today, we are proud to say we refuse to allow the dream of those who gathered in Clipton to die and disobey Oliver Tambo instruction. As I stand here today, Mpumalanga has improved the life expectancy of both blacks and whites to 67.4 years for females and 62.8 years for females. And we have reduced the infant mortality of blacks to almost 11%. It's also encouraging that all surveys demonstrate that on average, South Africans, both in rural and urban areas, travel less than 15 minutes to get health services, unlike past wherein they will travel between 30 to an hour. This is a clear demonstration that even though our present realities have birthmark of this unjust past, we will never allow the dream of those who gathered in Clipton to sag down like a heavy load. Madam Speaker, the Freedom Charter clearly articulates that no government can justly claim authority unless it is based on the will of all the people, close quote. And as a result, with this budget, it's not an isolated administrative tool or list of numbers, but a concrete expression of the hopes and aspiration and will of the people of Mpumalanga, who in their numbers voted for the African National Congress in the 2024 general elections. It is grounded in the ANC manifesto, which directs us to invest in people by expanding access to healthcare and by promoting preventative healthcare campaign, amongst many other things. Madam Speaker, this budget is also anchored in our nation's broader vision for a just and dignified future. It is shaped by the National Development Plan 2030, which calls for the healthcare system that is accessible to all, rooted in equity, efficiency, and a patient-centered ethos. It echoes the 2025 State of the Nation address, where President Cyril Ramaphosa reaffirmed government's unwavering commitment to the national health insurance, the strengthening of primary health care, digital transformation, and tangible improvement in frontline service delivery. Our direction is also guided by 2025 State of the Province address, in which our Honorable Premier declared 2025 as the year of service acceleration, an imperative that drives our determination to expedite progress for the betterment of the people, of our resident, every resident. Furthermore, this budget is informed by the Mpumalanga Medium-Term Development Plan 2024-2029, which prioritizes the modernization, our health governance and accountability structures, upgrading health infrastructure and information system, and advancing maternal and child health. It also commits us to intensify our fight against HIV, TB, and non-communicable diseases. In every sense, these policies and plans are not abstract aspiration. They are the living blueprint of our collective promise to the people of Mpumalanga to deliver a health system that leaves no one behind. Honorable Speaker, the success of the meeting which adopted the Freedom Charter was preceded by a very intensive campaign of mobilization of South Africans to define a South Africa of their dream. Inspired by the generation of Zetken Matthew, which mobilized for the Congress of the People, I will continue to conduct a Cheka Impilo campaigns, which are aimed at making sure that the 5.1 million people of Mpumalanga know their health status for us to improve our health outcome. Like Madiba was a volunteer-in-chief of the Defiance campaign, which made sure that the Congress of the People becomes a success, I will also invite our Honorable Premier to be the volunteer-in-chief of Cheka Impilo campaign, which will visit people in their household, their places of work, their churches, and almost everywhere where people gather to encourage them to check their health status. We want the people of Mpumalanga, especially men who seldomly visit health facilities to know their health status and start taking necessary preventive measures to avoid late presentation to our facilities when their illness is already at the terminal stages. Honorable Speaker, I invite you and the Deputy Speaker and all honorable members to join me in this campaign. And we can begin after this sitting, as the officials of the department are here to check on your vitals. So let us make sure that before you go home, make us a favor as a Department of Health for people to live long, just via there and check your vitals. Let us check our Impilo campaign as a successful as a Congress of the people and make it have an indelible mark in the future of Mpumalanga. Forward with Checker Impilo, forward. Forward with Checker Impilo, forward. Madam Speaker and honorable members, our commitment of providing free healthcare hospitalization for all makes it compulsory for us to understand.
Honorable MEC, can you please take your seat? Honorable Sidibe.
Thank you, Honorable Speaker. This is pertaining to you. Please just warn the audience that they are not allowed to clap hands or shout. If she say forward, she does not refer to them. She refer to us. Can they keep quiet?
No, thank you very much, Honorable Sidibe. Indeed, honorable guest, you are not allowed to participate. You are just observing the proceedings as our rule states that. Honorable MEC, you can proceed.
Thank you, Honorable Speaker. According to Statistics South Africa, Mpumalanga population expanded from approximately 4 million in 2011 to nearly 5.1 million in 2024, an increase of close to 30% over just 13 years. This sustained growth trajectory over ranging about 1.2 annually has placed escalating demands on every facet of our public health system. The department's budget allocation have accordingly required continual adaptation to keep pace with this democratic shift. Since 2011, provincial health budget has seen incremental increases aimed at broadening service coverage, expanding infrastructure, and recruiting more frontline health workers. However, the reality is that the rate of population growth has often outpaced increases in real per capita health expenditure, and these budget increases were below inflation. This dynamic has resulted in diminishing resources, increased patient loads, and mounting pressure on existing facilities and personnel. The impact of these trends is tangible across the health system. Public clinics and hospitals must serve a larger and more diverse population with limited increase in staff and equipment. The surge in demand for maternal and child health services, for instance, reflect the province's youthful demographic profile and persistent challenges like teenage pregnancy. Similarly, the fight against communicable disease such as HIV, TB requires sustainable resources and innovation in the face of growing patient cohorts. Madam Speaker, but as a department, we have refused to betray the wishes of those who gathered in Clipton in 1955 and continue to forge ahead with expanding our health service despite the budget austerities. MEC Treasurer always says when you go to him, austerity measures. So as a department, we'll continue to provide service irrespective of the austerity measures. That is why I'm delighted to report that over the years, Mpumalanga has steadily expanded specialization service across the tertiary hospitals. This deliberate enhancement has enabled the province to offer a broader range of advanced medical care, including specialized diagnostics, complex surgical procedures, and dedicated units for critical care, oncology, cardiology, and pediatrics, just to mention the few. Don't raise your head, Honorable Sidibe, and say I must repeat. While this expansion have added new strains to already limited resources, They have also substantially reduced the need for residents to travel outside the province in search of such services. This ongoing growth in specialized healthcare capacity demonstrates Mpumalanga's commitment to delivering comprehensive, high-quality care locally, thus easing the burden on families and strengthening the resilience of the provincial health system. It is against this commitment to expand the quality of our healthcare that we welcome the announcement by Minister Motsoaledi to construct the first ever in the province a central hospital in Mpumalanga. I think this needs a round of applause, Honorable Speaker. Madam Speaker, the data before us is not merely a set of statistics. It is a call to action and a reflection of our political will to build a fairer, healthier Mpumalanga for all. In a world where resource allocation too often mirror entrenched inequalities, this administration stands firm. Our budgetary decisions are instruments of social transformation aimed at dismantling historical disparities and advancing the rights and dignity of every resident. Comparing our current achievement with last year's figures, we see both progress and persistent challenges in the previous financial year. The department is having 21,724 permanent employees, of which 62% are healthcare workers. The department is currently in process of advertising 246 posts in the midst of financial constraint, demonstrating an unwavering commitment to strengthening the health workforce. The number of healthcare workers trained in crucial clinical skills grew from 800 last year to 945 this year, strengthening our capacity to deliver quality care. The department valued the service of the 5.192 community health workers employed on contract across all districts. To date, no fixed-term contract community health workers have been permanently absorbed in the Mpumalanga Department of Health since in the previous one. And as noted, the department is following due processes in aligning with national guidance and budget planning framework. However, it is of note that something life-changing will be implemented soon for our community healthcare workers in the province and in the country. Last financial year, MDR TB treatment success rate stood at 73.5%, rising to 75.7% this financial year. ADAT-ART viral suppression improved from 89.9% in the 2023-24 to 91.4% by the end of 24-25. Maternal and child health indicators in Mpumalanga continue to show encouraging progress. Notable, the percentage of postnatal visits within 6 days of delivery rose from 84.5 to 86.2, reflecting improved access to and utilization of essential postnatal care. When we reflect on our overall child health outcome, it is clear that Mpumalanga continues to set the pace nationally. This is reaffirmed by the District Health Barometer, which rigorously tracks health performance across the province. In 2023-24 reporting period, Mpumalanga recorded the highest national coverage for immunization under 1 year at an impressive 93.3%, far exceeding the national low of 69.4%. Our measles second dose coverage also led the country, reaching 90.6%. Furthermore, the TB treatment initiative rate for children under 5 years once again stood out, with Mpumalanga achieving at outstanding 98.2%, among the highest rates in the country. This consistent performance places Mpumalanga at the forefront of child health and prevention strategy in South Africa. In addition, we achieved a significant reduction in malaria cases, malaria death. There's nothing so painful to see our people dying also in terms of malaria. The cases decreased from 2,578 in the 2023-24 financial year to 1,067 cases last financial year, depicting a 59% reduction in terms of the infection of malaria. While malaria death decreased from 21 deaths in the 23-24 financial year to 3 in the 2024-25 financial year, a remarkable 85% reduction. And those that are working in the unit of malaria, they've promised me to say MEC, because I said with 3, we are moving towards zero rising malaria, especially the death in the province. Another significant achievement that is of note and that has changed people's quality of life by restoring their eyesight through the implementation of the cataract marathon. In the beginning of the 2023-24 financial year, the department had a backlog of more than 14,000 cases of cataract, and we dedicated Tonga Hospital Cataract ukuvula bogogo abangaboni ukuzokuthi bazophila impilo efana nawo wonke umuntu in the province. So we care so much about our old people in the province. Tonga Hospital is a center, and I can report that the backlog has since been reduced from 14,000, as I've said, to 4,636. And we're going to continue and make sure that also this one, the number will zero rise to a 0 as we work with our committed healthcare workers in the province. By the end of the last financial year, we have done a total of operation of 10,292 operations conducted since 2023-24 financially to date. Our aim is to make sure that indeed we eradicate these numbers. Madam Speaker, however, let us be candid. While these incremental gains are evidence of strategic investment and principled leadership, significant obstacles remain. Antiretroviral treatment retention rates and the prevalence of teenage pregnancies and malnutrition-related death continue to demand agent-targeted action. Capital expenditure execution tough lagging of at 22.2% highlights the need for redoubled effort in project delivery. We acknowledge the challenge currently facing our EMS, emergency medical services, and we wish to affirm that we are fully aware of the situation, hence we made a commitment of procuring 10 ambulances annually every year, but we can report to this House that we managed to double our effort last financial year with the support of the Honorable Prim. Honorable Prim masifaka 10. What I mean, njengobaba ngizo-add 20. So in the last financial year, out of the 10 that we committed, we managed to buy 30 ambulances. And this year we are planning to procure 15 extra ambulances, and we are committed to turning the situation around through the implementation of effective, efficient intervention that will restore and enhance service delivery. As we move forward, this government reaffirms its resolve to not only track output, but to hold ourselves accountable for outcomes that change lives. Our vision remains clear to ensure that every rand spent advances the cause of social justice, working tirelessly until citizens of Mpumalanga is afforded the health care they deserve. A people-centered approach, Madam Speaker, the Honorable Premier, our service delivery priorities are purposefully designed to realize the principle of universal health coverage and the progressive implementation of the National Health Insurance. Through targeted investment in infrastructure, workforce, digital system, and access to essential medicine, this budget lays the foundation for the transformed, equitable healthcare system that meets the needs of all our people, especially the vulnerable. Key to achieving universal health coverage is ensuring that all individuals and communities receive the health service they need without suffering financial hardship. Mpumalanga's low medical aid coverage, that is the reality. Only 9.8%, according to Stats South Africa 2023 General Household Survey, means that over 90% of our citizens rely entirely on the public health system in this province. So this number, 9.8%, is very low. So it means as the Department of Health, we are servicing almost everyone. I'm saying this because even this 9.8% that are claimed to be having medical aid, now they don't have any budget. So they go back to our facilities. So hence we are saying that these numbers shows you that indeed, as a Department of Health, with the increasing population, with more people relying on the public health services, it's a challenge that all of us as a department, together with yourself, we are saying we are still continuing to move and make sure that we provide the services that our people deserve. This makes the acceleration of the NHI implementation in our province a strategic and moral imperative. Madam Speaker, to this end, our department is actively scaling up the ideal clinic realization and maintenance program, which at 98% in the PAC facility already compliant. So we are moving the remaining 2% of facilities that did not achieve compliance, were not assessed due to the various reasons, including being under construction, newly established, or facing infrastructure constraint. To support the full implementation of the ideal clinic realization and maintenance initiative, the department has ring-fenced 12,621,000 for the procurement of necessary material, and the procurement process is currently underway. Bangala District is a provincial pilot site for the implementation of the NHI contract units for primary health care. It is therefore transitioning to universal health coverage under the National Health Insurance, ensuring that there is collaboration and working together between private and public health care facilities. To further support primary health care facilities and improve outcome, 20,415,000 has been set aside to contract 48 general practitioners in the 2025-26 financial year who will visit clinic at least once a week, increasing access to medical care and reduce the bypass by the clinics, because we know that our people, uma ngabonanga udokotela ubona ngathi akakabona. Kanti even our primary health care lapha clinic, once you prioritize what we started with, check impilo after 3 months, you will continuously go to our clinic without even having to be transferred to any of our hospitals in the province. To strengthen the clinical governance in primary health care facilities, including district hospital, we have set aside 15 million to appoint district clinical specialists to enhance capacity and provide support to PHC facilities. The appointment process is currently underway with the goal of having one team established per district. In response to the acute shortage of mental health professionals and the growing demands for mental health care services in the province, we have budgeted 14,395,000 to expand mental health care services by contracting 15 registered counselors, 5 medical social workers, clinical psychologists, and occupational therapists. These professionals will be deployed to hospital and PSC facilities. This is real, and everyone can be affected. Hence, it's important to make sure that all of us, we visit places, recreational facilities, amadoda, we watch TV, we play with our kids, we make sure that we are there for our families, because that on its own reduces the mental health problem that our people are facing. To further strengthen maternal and neonatal services, a dedicated budget of 30,066,000 has been set aside for the procurement of essential maternal and neonatal care equipment for our hospitals. This investment will enhance our ability to manage complications during pregnancy, childbirth, and the neonatal period. Procurement processes are currently underway. In our effort to improve access to the integrated school health program, a budget of 5 million has been allocated for the procurement of medical equipment to support school health teams. The primary focus will be the screening of grade R learners as mandated by the National Department of Health, ensuring that developmental and health challenges are identified and addressed early. This investment demonstrates our commitment to building a health system that protects the most vulnerable, our mothers, our children, and our learners through strengthened primary health care and specialized support at every level. Madam Speaker, this integrated approach ensures that the public health and our learners through strengthened primary health care and specialized support at every. Madam Speaker, the province is still on course to expand tertiary services and improve access to our people. The following progress can be reported. The province is continuing to offer chemotherapy oncology services, and a total of 1,995 patients has been diagnosed and treated for different cancers in Rob Ferrer. These before were supposed to be traveling to Gauteng, but now it is happening in Mpumalanga province. Even though the province is still referring some of the patients for only radiation therapy to Steve Biko Academic Hospital to eliminate this referral of our patient to other provinces, a service provider, to realize this. In the same breath of reducing the numbers of patients referred to private sector and outside the province for MRI services, we can report that we have installed, Honorable Grobler, an MRI machine in Roferere Hospital, which is functional and takes referrals from across the province. So now I'm no longer talking about training, I'm talking about already taking patients here in Roferere Hospital. We have just established and launched a BANS unit in Roferere Hospital, one of the first of its kind in the province. And it admits BANS patients across the province. The unit is equipped as an ICU, and it is comparable to any BANS unit in public or private sector. The BANS unit is equipped such that over the chronic patients for dialysis, and by the end of the third quarter, all chronic patients of Roferele Hospital will be dialyzed in-house, meaning that there's no patient that will be taken to any of our private hospitals in the province. This is a demonstration that the state can develop capacity to offer tertiary services without reliance on private sector. There's a plan to establish the third dialysis center in MLO Hospital to cater for Gersibande patients, because as a province, we've got three districts. So if we can have one in each district, it means that completely in the province, we will be dialyzing in-house in the province of Mpumalanga. The plan for 2025-26 is to install dental laboratory at Witbank Hospital and catheterization laboratory, cath lab, in Roferere Hospital. The cath lab will greatly improve the management of cardiac condition. The department is in the process of digitalizing X-ray equipment in all of our hospitals. To date, we have digitalized 17 out of 28, and for this financial year, we are planning to add 3 more, meaning that after these 3, we will have 20 and we'll be left with only 8. This is important because it also assists in terms of making sure that patients don't have to be transferred, some of them. You can share specialists with our tertiary hospital or any other specialist that you can find to assist our people to be treated in our rural provinces and municipalities that we are having. And the hospitals where we are going to buy is Tinswalo, Benny Samuel, and Caroline Hospital. The province has 3 regional and 2 tertiary hospitals that are referral center as they provide specialized services. Just recently, from the 7th to the 11th of July 2025, Madam Speaker, we have conducted what we call orthopedic marathon in those hospitals. We had a backlog of 504 patients and a total of 215 just for that week of 7 until 11 patients were operated. And 7 patients were cancelled because, remember, we must first, sometimes I receive call, umuntu wami simlethe esibhedlela sort of operate, abazi uku-operate if ba-check ukuthi awukho right esimeni somzimba. So that's why the 7 were cancelled, because they were not fit for operation. But then we'll continue to make sure that the remaining number, we do other marathon so that we are dealing with the backlog. If you can look in other provinces, the backlog is very high. We so many specialists, but the committed team of the specialists in the province, they understand that when they receive an appointment letter, even if the appointment is saying Witbank, they will go anywhere in the province and give and provide services to our people. Want to thank them because they are committed. Indeed, when they took an appointment from health, I always say it is not a job, it is a calling. And these specialists are doing exactly that. The backlog now stands at 281 patients, and the department is still having noticeable a higher number at Witbank Hospital, and hence we are going to continue with the marathon in those facilities. It should be noted that during May 2024, We managed to operate 113 patients and in Witbank alone, meaning that also the backlog in Witbank, we are starting to deal with those backlog. And also of note, Honorable Speaker, is that you must report that Mapulaneng and MLO Hospital, you only wait according to the normal waiting time, meaning that they don't have backlog of people waiting, meaning that as and when patients come, they operate them. That's what we want to move towards, making sure that we no longer talk about backlog, but we're talking about our people getting treatment as and when it is needed, with the limited resources that we are having as a department. Madam Speaker, Mpumalanga province, like most rural provinces, experienced a shortage of specialists. In an effort to increase the pool of specialists, the department has established a register program where doctors are offered bursaries to train as specialists, and currently there are 30 registered people that were doctors that we have took to academic hospital to train in university across the country. We are beginning to see the results of this program as some of the doctors are coming back to serve the province as specialists. For 2025, an additional 5 registers came back and have been allocated in our regional and tertiary hospital. So this is what we are doing to intervene, not complain that people don't want to come and work in Mpumalanga. Take our own, go and train them, come back. With that contract, they must come and work in the 5 of our hospital. To date, we have placed back not less than 15 specialists in the regional and tertiary hospital, including cardiothoracic surgeon, and just recently, a pediatric cardiologist who came back into the province from the 1st of July, 2025. Honorable Speaker, from Mapulaneng to KwaMhlanga, we are building hospital, upgrading wards, and modernization equipment. Infrastructure is not just bricks and mortar. It is dignity, it is access, and it is life. Madam Speaker, the department has allocated 1.7 billion for infrastructure development, including 183 million specifically earmarked for the maintenance of health, facility, and life-saving equipment. The construction of the new Mapulaneng Regional Hospital remains on schedule. It is expected to be completed by June 2026, June next year. Several projects are currently progressing at various stages, including the new KwaMhlanga Hospital, maternity unit, new Troya Clinic, new Dumfries Clinic, MNTD Clinic. Furthermore, the construction of 7 new clinics that the Honorable Premier announced: Alexandra, Lebogang, Vezobuhle, Babaton, Kinrose, Langkloof, and Lefiswane, as well as the upgrade of Siabuswa CSC, are scheduled to commence in the 2nd quarter. The following projects have been successfully completed and commissioned: the new King Nyabela District Hospital, maybe you might not know the name, Middleburg Hospital, which become operational during the 2nd quarter. The upgrading of Mamitlake Hospital, the upgrading of Brooklyn Clinic, refurbishment of Shatale Clinic, the construction of new Castile 3 copies clinics. In accordance with the National Development Plan 2030, department has appointed 35 artisans, 50 EPW artisan assistants over the past financial year, specializing in electrical work, plumbing, air conditioning, and painting. Yeah, the way they are so working, somebody called me, Ati, yeah, I went to a clinic, I want to check how much did you spend. Ati, when I look at the work, I think you spend around 12,000. But I know very well that as a department, you have spent millions. You are correct. We have spent less than 12,000 because these are the people that we have employed that are moving from one facility to the other, making sure that maintenance is done in our facilities. And additionally, we are planning to recruit further 88 artisan interns contributing to poverty alleviation and effort to address youth unemployment. Madam Speaker, we are hiring, we are training, and we are promoting. Our goal is clear: a health workforce that reflects the people it serves, young, diverse, and empowered. A capable, ethical, and future-ready health workforce is not a luxury, it is a public imperative. We are transforming our department by prioritizing diversity, youth, and gender equity. I'm proud, Honorable Speaker, as a woman yourself, to announce that as from April 2025, women make up 50% of our senior management in the Department of Health. True progress for inclusive leadership in the Department of Health. To empower our youth and strengthen our system, we have placed 248 medical interns and over 720 community service professionals in hospitals across Mpumalanga. Our bursary and partnership programs are training doctors, registrars, and specialists drawn from our communities, ensuring healthcare is delivered by those who know our people best. Leadership is a backlog of reform. 10 emerging leaders are enrolled in the Albertina Sisulu executive programs, and 8 have graduated, strengthening our governance and vision. We are filling critical vacancies, supporting training in scarce skills, and aligning every appointment to real health needs. We are institutionalizing ethical leadership, succession planning, and a result-driven culture. Honorable Speaker, our unwavering commitment is to ensure that every rand entrusted to us directly benefits our people, not bureaucrats. In the business of health, accountability is not a choice, but a solemn duty. It is our conscious obligation to uphold transparency, integrity, and service delivery in every decision and action we take. I'm ecstatic to announce that the department maintained unqualified audit outcome for its annual financial statement in both 2022-23, 23-24, reflecting strong financial reporting and internal controls. Performance audit under Program 2 remained a challenge, indicating ongoing challenge and a few internal control deficiencies which are receiving the necessary attention. The department showed a slight improvement in unauthorized expenditure in 2024-25, but its continued presence signal of a need to continuous budgetary constraint. Honorable Speaker, we can confirm that the department has never incurred unauthorized expenditure in the past 9 financial years. The department still has a challenge with irregular expenditure due to previous contract. However, all investigations were conducted and consequence management is being implemented because these were contracts long time ago to promote financial discipline and prudence. The department fruitless and wasteful expenditure also surged in 2024 financial, which is a result of delayed in the implementation of the Lina Malachi Hospital project, which has come with several challenges to this point. Honorable Speaker, Mpumalanga should note that the department has undoubtedly demonstrated consistent budget utilization, spending 99% of our budget across all years. Accruals and payable decline steadily, and additionally, what is key, I know small business will be happy. Additional, supplier payment timeline improved with average days reduced from 19 days. We don't go to 30 days. We're at 90 days, but now we're at 14 days, reflecting an enhanced operational efficiency and compliance with the PFMA. Furthermore, given the current economic challenges and stubbornness of poverty in our province, the revenue collection of the department showed strong growth, rising nearly by 50% over the past 3 years. So we are collecting. So those that are here, you know you are working. When you go to the hospital, you must pay because it is only free for those who are not working, our old people and those who are not working. Honorable Speaker, as we navigate the era of digital transformation, the Mpumalanga Department of Health stands ready to modernize, strengthening the system for the future. We are committed to upgrading ICT infrastructure and support national health insurance universal coverage. We are introducing clinical and patient administration system, which we called One Patient, One Record, One Digital Health Record. And as I'm about to close, the 2025-26 budget, Madam Speaker, indicate that the Department 25-26 budget of 19,750,974,000 rand. And it's more than just a financial allocation, but a strategic mandate that has been allocated as followed. Program 1, the amount of 421,091,000 rand is allocated in the current financial year. Program 2, District Health Service an amount of 11,779,259,000 rand. Program 3, Emergency Medical Service an amount of 576,377,000 rand. Program 4, an amount of 2,242,000 rand is allocated. Program 5, Central Hospital Service, an amount of 2,204,272,000 rand. Program 6, Health Service and Training, an amount of 587,239,000 rand. Program 7, Healthcare Support Service, an amount of 407,028,000 rand. Program 8, Health Facility Management, an amount of 1,775,536,000 rand. Madam Speaker and honorable members, this budget vote is our pledge to our people of Mpumalanga, and it is promise of the elderly and the child and the health care. Allow me to end by thanking the Honorable Premier, Honorable Mandla Ndlovu, for the support and guidance he continuously provides, my organization, the ANC, for this noble opportunity, the Provincial Secretary, Comrade Muzi Chira, to serve traditionally and religious leaders for always willing to cooperate with our department, the people of Mpumalanga for their patience and guidance wherever the need arises, organized labor, and for the endless counsel and robust engagement. Yeah, this is very key, very robust engagement. The HOD and entire administration. Lastly, I'd like to thank my family, my mother and my father, they are here with me, friends, comrades, and for their support in good and difficult moments. Thank you very much, Honorable Speaker.
Thank you, Honorable MEC S.J. Manzini, for the well-delivered policy and budget speech. The Secretary shall read the sixth order of the day.
Order number 6, consideration and debate on a report of the Portfolio Committee on Health, Vote 10, Department of Health.
I now call upon the Chairperson of the Portfolio Committee on Health, Honorable M.N. Mhlongo, to table the report.
Thank you very much, Honorable Speaker. I rise as the Chairperson of the Portfolio Committee on Health to table the report for consideration. Thank you very much.
I have a speakers list in front of me. I will now call upon the Honorable M.N. Mhlongo, and you are given 8 minutes.
Thank you very much, Honorable Speaker. Honorable members of this august House of Traditional Leaders led by the President of Contralesa, Kgoshi Mokoena, our guests, and all protocol observed. Honorable Speaker, the department's vision is a long and healthy life for all South Africans. This vision is supported by a mission to improve health status through disease prevention and health promotion, and to consistently enhance the healthcare delivery system by focusing on access, equity, efficiency, quality, and sustainability. Honorable Speaker and members, the Department of Health, as mandated by Section 114 of the Constitution of the Republic of South Africa, Act 108 of 1996, to determine whether the department has specific, measurable, achievable, realistic plan and sufficient budget to implement an efficient and effective economic service delivery to all the people of the province during the 2025-2026 financial year. Honorable Speaker and honorable members, as we participate in this budget vote of the department, we recognize July as Mandela Month, a time to improve the lives of South Africans. Honorable Speaker and honorable members, we would like to underline the importance of having a sufficient budget for the Department of Health to meet its goals and provide high-quality healthcare services. Honorable Speaker, the department met on May 16, 2025 to formally launch the provincial Close the Gap campaign, which aims to identify the 134,000 people, Mpumalanga citizens who have tested for HIV and are not yet receiving treatment, as well as to identify the 9,380 patients who have tested positive for TB but are not receiving treatment. Since the campaign inception in February 2025, the provincial gap has decreased. Honorable Speaker and honorable members, we want to make a proclamation that the department is committed that the people of Mpumalanga have access to quality healthcare, and we want to applaud the department for successfully implementing the National Electronic Medical Record System, aimed at ensuring that patients' records are kept safe in computers, and it was tested in 7 primary healthcare facilities in Steve Tshwete local municipality. Honorable Speaker, we acknowledge that healthcare workers in various healthcare facilities face attacks in their workplace, and we appreciate the department that security features in healthcare facilities across the province are being enhanced. Additionally, the appointment of 3 district security managers will create strategies to boost security in healthcare facilities, along with 30 interns who will be helping facilities equipped with CCTVs. Honorable Speaker, we are delighted that the department has set up 21 security cameras in healthcare facilities identified as high-risk areas with the aim of outfitting all facilities. Honorable Speaker, we reaffirm that health remains a priority of the African National Congress and the ANC-led government. The ANC remain guided and committed towards the ideas of the Freedom Charter. In this regard, we are enjoined by the Freedom Charter to build a society wherein South Africa belongs to everyone who lives in it. It is on this basics, on the above conviction that as the ANC, we consider health to be the most important aspect of development due to the reason that its primary intention is to deal with poverty, unemployment, and inequality. Our past historical reality has afforded us an opportunity to reflect on the variation in terms of race, social stratification, in that it determines quality and access to health. Honorable Speaker, the department has 24,086 permanent funded posts and 21,079 are filled. 3,010 are in the process of being filled. Furthermore, no additional funds have been allocated for the new appointment since resources are reprioritized in preparation for the national health insurance. We also appreciate the 18 facilities at Etlazeni that are with renewable energy resources, which is your solar and your batteries. That is 13 in Bombela PHC's facilities and 5 in Nkomazi municipality. Good quality healthcare is a fundamental right for every citizen. Hence, we support this budget vote. In closing, Honorable Speaker, the first democratically elected president of South Africa, Comrade Nelson Mandela, said, I quote, "Health cannot be a question of income. It is a fundamental human right." Close quote. I thank you, Honorable Speaker.
I now call upon the Honorable BP Ngumayo, and you are given 8 minutes.
Thank you very much, Honorable Speaker, members of the legislature, Kitamishe, Khoshimukwena, and all progressive leaders of Umkhonto weSizwe, Sanbonan, Abshen, Dumela, Locha. Honorable Speaker, I rise to represent Umkhonto weSizwe Party in reflecting about the Department of Health Budget Vote 10. MKP will first note the budget as presented by Honorable Manzini. We have 4 reasons noting the budget, including inadequate funding on all the other programs that are there in the Department of Health. Number one, inadequate funding. The budget allocation for Health Department is insufficient to address the province's healthcare needs. These include the inability to upgrade the infrastructure in our health facilities, the recruitment of much needed personnel and provisions of essential services. Most critical health programs are not properly funded. Mental health services are underfunded, and the HIV/AIDS, which used to be funded through the USAID, has not received any added allocation to compensate the withdrawn funding to ensure continuity in these services. Poor resource allocation. Honorable Speaker, it is a known fact that the Department of Health is unable to allocate resources in an equitable manner. Some health facilities continue to receive inadequate funding and personnel, while other facilities are better resourced. For example, you can find that in the most rural areas in our communities. Honorable Speaker, not long ago, we mentioned in this House that human resource in our provincial hospitals are a problem. Our hospitals are currently serviced by less than 5 pathologists in a population of approximately about 5 million residents in the province, plus the influx of foreign nationals which are coming into the province on a daily basis. As MK Party, we urge the Department of Health to develop a resource mobilization strategy which is going to sustain these programs and mobilization to resource from various sources that is needed. You can count government grants, private sector donations, and international partnerships. Lack of focus on primary health care. Honorable Speaker, we are convinced that this budget prioritizes tertiary health care over primary health care, which is more critical for preventative care and early intervention. Community health care services, including outreach programs and health education, are neglected. This directly compromises the health and well-being of our communities. Umkhonto weSizwe proposes that the Department of Health must explore partnerships and collaborations with local organizations, including your NGOs and community-based organizations, to make sure that our people are given better education through the staff that is there in the Department of Health. Inadequate support for healthcare workers. Honorable Speaker, healthcare workers continue to be neglected and receive inadequate training and development opportunities, which are very key. And if they continue being denied development opportunities, that compromises their ability to provide quality healthcare to our people and the patients. Healthcare workers are faced with poor working conditions, which also include inadequate infrastructure and equipment. Sibonile, Honorable Speaker, some of the healthcare workers were raped, brutally murdered, and the safety of our health workers is being compromised. The department needs to invest in capacity building, the programs that will seek to boost staff morale and also bring back confidence by enrolling healthcare workers on programs such as management, financial, and resource mobilization. In that way, healthcare workers will appreciate the fact that they are also important and valued. In closing, Honorable Speaker, it is important that the Department of Health make its monitoring system and evaluation unit a functional and track progress and identify areas of improvement so that the Department of Health conduct regular reviews of programs to ensure that they meet the departmental objective and make necessary objectives. As indicated earlier, Honorable Speaker, Umkhonto weSizwe support the budget on condition that we need to make sure that the plan that is developed by the department indicate how important it is for our people to get help in our medical facilities. We're not only going to monitor the budget, but we're going to make sure that we don't repeat what happened in the last quarter, where resources were misused and funds were not properly used. We will make sure that we make amends and make sure that our province still remain the best in this Department of Health. Senketa, Honorable Speaker, siyabonga kakhulu ukuthi le department abantu abahlala kuyo bawuthanda umphakathi weMpumalanga, but we will not rest until all members of the department are well cared for. Singakhohlwa ukuthi sijabuliswe nokuthi omunye uDr. Nobuhle Nkabane of the GNU was removed, and we will make sure that those who don't do what is right in this department will follow Dr. Nobuhle Nkabane. So we know ukuthi iGNU iyasebenza and iyosebenza nala eMpumalanga. Ngiyabonga.
I now call upon the Honorable DP Nkosi, and you are given 8 minutes.
Honorable Speaker and Deputy Speaker, Honorable Premier and members of the Executive, Chief Whip of the Majority Party, Honorable Makhabane, Honorable members of the Provincial Legislature, Chairperson of the House of Traditional and Khoisan Leaders, Hoshi Mokoena, and all senior traditional leaders who are in this chamber, the Provincial Secretary of the African National Congress, Mr. Chiro, I greet you all. It is an honor and privilege for me to be entrusted with this responsibility by my party, the African National Congress, to participate in the budget vote 2025-2026 of the Department of Health. This year, as we have already said, Honorable MEC, marks the year since the 70 years since the adoption of the Freedom Charter, which declares that a preventative health scheme shall be run by the state. Free medical care and hospitalization shall be provided for all, with special care of mothers and children, close quote. Thou who are not yet to see the realization of these aspirations, there are milestones we have achieved to reflect on. Passing the National Health Insurance was and is a step towards the right direction in realizing the aspirations of the Freedom Charter. If a policy, Honorable Speaker, is intended to benefit the poor and the disadvantaged, it is bound to face some resistance from those opposed to equality and transformation. An example, there has been a court challenges to the NHI from the big corporation and other parties which have been unduly benefiting from the government subsidies on medical aid. The fundamental mandate of the Department of Health, as enshrined in the Section 27(1)A of the Constitution, is the right to health care services. The Constitution places a non-negotiable responsibility on the state to improve its citizens' health status through the prevention of illness, disease, and promotion of healthy lifestyle, to consistently improve the healthcare and delivery system by focusing on access, equality, efficiency, quality, and sustainability. The policy and the budget speech which has been delivered by Honorable Manzini is telling us exactly that health is faced with a rise of number of non-communicable diseases, and that requires that the department channels most of its resources in the fight against NCDs. I know for a fact, Honorable Speaker, that this budget is going to assist people with high blood pressure and related complications, people with diabetes, cancer, mental illness, chronic respiratory diseases, to mention a few. The department's strategy for NCDs is emboldened on prevention, early detection, and effective treatment where cure is possible. Managing our lifestyle, as the Honorable MEC has said, is of utmost importance if we want to prevent certain and most ailments. Examples of managing our lifestyle include among the following: regular physical activity, eating healthy life, avoiding high intake of salt and fat, drink water instead of fizzy drinks, especially those with high concentration of sugar, not drinking alcohol or otherwise doing so in a moderate amount. Among the means of preventing and controlling the non-communicable diseases, Honorable Speaker, the National Department of Health is implementing the NCD campaign to improve early detection and link patients to care. The campaign led to an increase in the number of people screened for hypertension and diabetes, so that those diagnosed with these conditions can be initiated on treatment as early as possible. The annual performance plan of the Department of Health corresponds with the ANC policy and strategic objective as per our manifesto on health. That is our 2024 manifesto. If anyone can read this manifesto, will note that it says that the ANC commits itself to promote healthy lifestyle and preventative health care campaigns. It also says it's committing itself to move decisively towards implementing the NHI, and also commit itself to expand the Ideal Clinic program to improve quality of care. We have, however, noted some challenges in our health facilities, ranging from staff shortage, budgeting for the absorption of community health care workers, to mention a few. However, this budget which has been presented, it has presented that the APP of this department will be able to support all of these programs, and the 19.7 billion, as it is aligned with the Mammoth task, is faced by the department. It's going to address the filling of 2010 vacant funded position, and it's going to prioritize the patients and staff safety by installing CCTV, and we appreciate that, Honorable MEC. It also emphasizes compliance with the PFMA on the payment of service provider. I written 30 days, but I've noted that you have said we are far ahead from what I've written. Honorable Speaker, budget constraints have limited the department's ability to realize this objective on a full scale. We acknowledge that there's still a lot to be done, especially in addressing the number of challenges raised by the committee. Honorable Speaker, the priorities set out by the departments are satisfying to endorse the budget of the department, which is 19,750,974,000 as tabled. I want to say that the ANC supported this budget. Thank you very much, Honorable Speaker.
I will call upon Honorable NP Mkabela, and you are given 6 minutes.
Thank you very much, Honorable Speaker. Honorable Speaker, allow me to Mishe, the President of Contralesa and Chairperson of the House of Traditional Leaders, Kgoshi Lemek Mokoena, and his team in our midst. Honorable Speaker, the budget vote for the Department of Health comes just a week after the Honorable Premier of the province, Mandla Ndlovu, reshuffled his cabinet. It would have made much more sense, Honorable Speaker, had the Premier also reshuffled the current MEC for this department, like he did with the former MEC for Education, Ms. Kathy Dlamini, who's not going to table any budget speech this week and bring someone to test whether the problem is with MEC Manzini's leadership style or with the people that she has surrounded herself with in that department, because the department has been crumbling for a very long time under the leadership, but we are not there since the reshuffling is news of the past. Honorable Speaker, as the economic freedom fighters, we support this budget vote simply because it is a budget that is meant to save the lives of our people in the province, not because the budget allocation or money is enough, but safe to say there will be no enough budget unless the leadership of the department is willing to change the model of doing things. Honorable Speaker, debates will not solve the issues that are faced by the department, but honestly, loyalty and commitments will do save this department from what it is today. Year in and year out, the budget for this department increases, yet it performs poorly. Honorable Speaker, the department is currently allocated over 19 billion for this financial year, and according to the report, the department has a total of 96 planned target for this fiscal year, which is worrisome. Honorable Speaker, how can we even begin to believe that the department will meet these targets that they have set themselves to achieve when they have been failing in the past years with lesser ones? As I speak, Honorable Speaker, there is a huge staff backlog in all our healthcare facilities, which the MEC has said it with her own mouth just now. Yet the department spend millions in training nurses who end up not being absorbed upon completion. This very same department is contemplating to establish yet another training college to be called College of Emergency Care in Old Middleburg Hospital, aimed at training emergency medical services. We view this as nothing but another looting scheme. The department should rather focus on hiring more nurses and doctors in our healthcare facilities, rather than to create another college who will just train and then dump them just like that as the order of the day without jobs upon completion. Honorable Speaker, just to remind you and the people of this province, in case you have forgotten, this department sends students to go study medicine abroad each year with a notion that when they complete their studies, they will be placed across our hospitals. But it doesn't happen like that. Otherwise, they find themselves roaming the streets, if not engaging in protest, demanding to be hired or placed by the same department. Please tell me if this is not contradiction at its best. And the question is, why do you waste money, send these students to go study if there's no plan to absorb all of them after they have completed their studies? Honorable Speaker, during the past financial year, this department incurred irregular expenditure, fruitless and wasteful expenditure amounting to over 15 million, yet we are expected to trust them with public purse. Honorable Speaker, this budget puts us in the middle of the department and the people because we choose to disapprove. Because if we choose to disapprove this budget, it means our people are going to continue suffering. Honorable Speaker, for an MEC who has been in this portfolio for 7 years now, since 2018, this department should be one of the most stable and properly run. But instead, we are still speaking about the poor state of our healthcare facilities in the province. But as I am about to conclude, Honorable Speaker, it is a worrying fact that this department has the highest number of lawsuits that takes a lot from the allocated budget, unless kuna bokoramfe na shikari, which we're also going to look into. To be precise, Honorable Speaker, this department incurred a total of 1,075 medical legal cases and has paid an amount of 47.7 million towards the settlement of contingent liabilities, while the remaining contingent liability stands at 6 billion. Just recently, the Public Service Commission issued a report revealing corruption and financial mismanagement in this department, which leaves a lot to be desired. Honorable Speaker, it is concerning that the Mapulaneng Regional Hospital doesn't have more intensive care unit beds, given the huge numbers the hospital must service, and we hope that this current budget will also be used to address all that. Honorable Speaker, as I conclude, the shortage of medication in hospitals and clinics is a cause for concern. The drug amphotericin 50 milligram has been out of stock for the longest time now. The drug is for meningitis, which a lot of people depend on. People have died because of the shortage of this medication. And to mention but a few, Mr. Masilela and Mr. Mnisi from Bosfontein and Drikopis in Komazi died as the result of the lack of this medication in the hospital. Also, grade 12 Lena Buhle from Kamhlushwa died as well because of this problem. And may their soul rest continue to rest in peace. Their death is because of the incompetence and negligence of the department. Honorable Speaker, with all that being said, we urge the department for once to change their gears and use the budget where it's supposed to be used and stop enriching themselves with the money meant for the poor of the poorest who do not have money to go to private hospital. I thank you.
I will now call upon the Honorable B. Grobler, and you are given 5 minutes.
Thank you, Honourable Speaker. Honourable Speaker, good afternoon and greetings to the House at large. All protocol observed, it's really a privilege to take part in this debate on behalf of the Democratic Alliance. Honourable Speaker, I would also like to start with the quote that seems to be the quote of the day, but maybe it's because it's Mandela Month. And that quote is the one that says health cannot be a question of income, and but it is a fundamental human right. Honourable Speaker, through you, Honourable MEC, what you said in your debate, in your tabling of your budget now, is really inspiring, and it gives us a lot of hope. But unfortunately, it differs a bit from what we see in reality when we move through the province. Unfortunately, it's not really what we hear from patients. Now, let me be the first to say that the Democratic Alliance understands that the Department of Health has probably got the most difficult mandate of all departments in this legislature, because it helps all ages, all genders, all races, and even regardless of your nationality. If you are here and you are sick, the Department of Health needs to help you. So it's a huge mandate. We understand that. But that's why we feel it's very, very important that we get the basics right. Because if we get the basics right, then the rest will follow. One way of getting the basics right is to have a proper patient management system. Now, Honourable Mhlongo mentioned this, but we've got this system. But unfortunately, it has happened that a patient disappears from a hospital, is found dead on the hospital's premises. It also happened that we lost 141,000 HIV positive patients. So how does this happen if we have a great system? If we get the basic rights, if we get the basics right, that won't happen. Why? If patients are tested, the file aren't opened, they get the treatment, and we have a proper record of them. Let's get that basic right. I'm very glad you mentioned the MRI scan at Rob Ferreira, because last time we spoke there was a bit of uncertainty. And I am glad to also confirm that it has been installed, and it does actually work. But Honourable Speaker, there's a problem. The MRI machine at this moment only works for stable patients with head injuries, because there's no tubes for unstable patients to incubate them so that they can be scanned on that MRI. Honourable Speaker, head injuries only amount to about 20% of MRIs that we perform in South Africa. 50% of MRIs are on spinal injuries, and then further to that, musculoskeletal injuries. So it's important for us to, on the MRI specifically, get the basics right, because then we can do way more scans, and that will save the state a lot of money. MEC, we've bought the machine. Let's use it to our fullest. Another one I want to mention where we can just get the basics right, because I have only got 5 minutes and it's difficult to speak about everything, is the Middelburg Hospital. It's been built. I was there last week. They're just busy with that road in front. It looks beautiful. But it's been opened twice, or I think even 3 times. I'm sure we're going to open it up again before the elections next year, just in time for the elections. But let's get the basics right, open up the hospital so that it can be used. We've got one tertiary hospital in the province that gives level 2 and level 3 services, but we've got too many primary clinics that also have to give level 2 and level 3 services. That opens us up for legal medical claims, and that places the department under huge pressure. So let's get the basics right on the things that we can. You spoke about the cataract what do they call, surgeries that we've got. Your number is actually higher than the one I've got, backlog. But I'm glad to hear about the marathons that there are. So let's continue with the marathons, because at the current state, it's going to take us 7 years to eradicate the backlog of that. Honourable MEC, the PSC has got a report that's quite damning against the department. It mentions our healthcare facilities that are in a dire state. It mentions hospital boards that are not functional. It mentions various things which we should look at to perform better in our healthcare facilities. As the Democratic Alliance, we support this budget because it's important for us that the healthcare in this province works. But we want to reiterate the fact that we need to focus on the basics. We need to focus on getting the basics right. One last one I want to mention in my last 10 seconds. It's great to buy ambulances, but if we can't appoint EMS personnel because we don't have the budget, it's a problem. Let's get the basics right, and let's get the healthcare facilities in this province working. Thank you.
I will call upon the Honorable W.L. Webber, and you are given 3 minutes.
Madam Speaker, namuhla jaussukuthuulet. As an opening statement, Madam Speaker, I want to thank the Honourable MEC. You will recall at this previous sitting, a condom was presented to me, but an apple-scented condom, and I complained. I told you I do not use apple-scented condoms. I prefer strawberry-scented condoms. And vrachtig, today a strawberry-scented condom was presented to me. Madam Honourable MEC, you are very considerate. Madam Speaker, my party does not support the NHI. And I want to challenge the members of this House. I want to bring a polygraph detector here, that you tell me, every person around in this chamber, that you have never used a private medical facility where you could have used a public facility because you believe a public facility is better than a private facility. I challenge you. And I want to challenge the members of this House once again. Do they really believe that that's a better system? I believe we can't afford it. We simply can't afford it. We don't have the money in this country to do that. And I want to see that the members of this House really prefer and think that is a better system. But then they must pass a polygraph tester to tell me that in future they will never use or attempt to use in South Africa or in Russia a private medical facility where they could have used a public facility in South Africa.
Conclude, Honourable
I challenge the members of this House, let's have a polygraph detector here that you tell us that you believe in what you're doing here. Because, Madam Speaker, you are not allowed to be untruthful in this chamber. You must be honest. You must tell the truth. You must, if you vote for this budget, you must believe in it. But if you believe in it, you must promise never ever to use a private facility where you could have used a public facility. That's a challenge, and I conclude. And once again, thank you, MEC.
I will now call upon the Honourable F.T. Mashiane, and you are given 3 minutes.
Honourable Speaker, I raise on the established protocol.
Honourable Mashiane, can you please take your seat? Honourable members, can you please conduct ourselves according to the rules of the House? Can you please not interrupt Honourable Mashiane? Honourable Mashiane, can you please take a stand? And you are given 3 minutes.
Thank you, Speaker. I've been a leader of MK for a minute. Mpumalanga's healthcare system remains in a fragile and deeply concerning state. The situation in our clinics, hospitals, and emergency services tells the story of a department that continues to struggle under the weight of mismanagement, underspending, and systematic neglect. Yet, Action SA recognizes the agents of the health crisis in our province and the need for funding to stabilize this critical sector. That is why, with great caution and firm expectations, we will support Budget Vote 10. Let us be clear, this support is conditional. It is a message to the department that the time for excuses is over, the time for performance, accountability, and delivery has arrived. The Auditor General has again flagged irregular expenditure and poor performance. Infrastructure projects consume millions, yet rural clinics in Dr. J.S. Mroko, Mkhonda, and Bushbuckridge still lack water and electricity, and the basic equipment needed to treat patients with dignity. Action SA believes healthcare is a fundamental right, not a privilege reserved for those who can travel to Gauteng or afford private care. We support this budget because the people of Mpumalanga need functional healthcare, but we demand a reliable and transparent supply chain for medicines and protective equipment, greater investment in mobile clinics for isolated rural areas, agent maintenance and protection of infrastructure from vandalism and decay, and above all, the fair treatment, resourcing, and payment of frontline health workers, our nurses, doctors, and EMS personnel. Honorable MEC, how can this House continue to justify budget allocations when residents of Kwaggafontein, Siabuswa, and Rietfontein queue for hours only to receive Panados, or worse, leave empty-handed? Action SA support comes with a warning: deliver or be held accountable. Because the lives of our people are not political talking points, they are a moral obligation.
Conclude, Honorable Member.
Let us restore dignity to public health care in Mpumalanga. I thank you.
I now call upon the Honorable Evim Lombo, and you are given 8 minutes.
Honorable Speaker, Mayor Masilela, the Deputy Speaker, the Chief Whip of the Majority Party, the members of the Executive Council, the Chairperson of the House of Traditional Leaders and Khoisan, Kgoshi Mokoena, all honorable members, our guests, and all protocol observed. Honorable Speaker, I'm proud to stand before you as an ANC deployee in this legislature and as a member of the Portfolio Committee on Health to debate and also provide the clarity of purpose on the measures that we have put in place in ensuring that the executive responsible for the Department of Health is held responsible in terms of the mandate given to this department by the people of Mpumalanga. We do this, Honorable Speaker, with full respect to our Constitution and all the legislations that gives us the powers to be able to oversight and take care of the public purse. In this regard, Honorable Speaker, I stand here to confirm that we have done our due diligence as the Portfolio Committee and we have exercised our duty of care, and as such, on behalf of the African National Congress, I want to indicate that we would request the House to support this budget that has been given to the Department of Health of 19,750,974,000. We request you to support this budget with a full understanding and appreciation that this budget should be used as a transformative tool to radicalize the social and economic transformation of society, because we believe as the African National Congress that the emancipation of the people is not achieved on the day when the national flag is hoisted or neither on the day when the national anthem is sung, but the struggle for the true liberation of the people continues beyond that. While we welcome the strides made by the African National Congress-led government to change the lives of the people to be better, we also acknowledge as the ANC and accept that there is still a long way that we need to travel to ensure that there is total emancipation of the people of this country, because presently the material condition of the working class in this country are not in a favorable mood. We still have got a task to ensure that the commanding heights of the economy are transferred from the hands of monopoly capital to the people of this country. Our mission will not be complete until we have ensured that the means of production and the forces of production are transferred from the captains of industry to the working class people of this country. We are determined as the African National Congress to ensure that we accomplish the mission of the ANC, to ensure that the material condition of the working class people of this country changes for the better. Hence, our appreciation that this platform, which is the legislature and the governance, should be taken as another terrain of struggle to prosecute our strategic intent, which is to realize and achieve the building of a truly united, democratic, non-racial, non-sexist, and prosperous society, a society where the free development of each will be the necessary condition for the free development of all. Let me indicate, Honorable Speaker, that as the ANC, we believe that this department, the Department of Health, it's one amongst the many departments in the province that is surely implementing the concept of the developmental state in action. We say that because of the department's speedy implementation of the universal health care coverage and the acceleration of the national health care insurance. We say this because of the department's priority in its huge investment in the job creation and service delivery. We say this because of the department in its priority to invest in the improvement of the infrastructure, the prioritization of the improvement of the security of the patients, of the staff, of the public, and also by ensuring that they put CCTV cameras in nearly all the institutions of health in the province to ensure that our people are safe in those institutions. We also appreciate the improvement in the life expectancy in the province of both men and women, as the Honorable ensure that our people are safe in those institutions. We also appreciate the both MEC have indicated she was appreciate the number of community health care centers in the province which are regarded as having reached the ideal clinic status, as having been mentioned by the Honorable MEC. But one of those centers, those community health care centers, is the Kanyamazane Community Health Care Center, which is like a mini hospital. If you go there, you will think that you are in a clinic that is in one of the suburbs. The expansion of the specialized healthcare facilities in the province, it's one advancement which we want to appreciate as the African National Congress, because surely it is part of the implementation of what we call the developmental state. The progressive moves towards the absorption of the community healthcare workers is appreciated by us as the members of the African National Congress, but also as the members who are part of that portfolio committee, which is also ensuring that the MEC and the entire department are held to account to the people of this province. The increase in the number of ambulances is for the transformation of our country, but also is for the defense of our revolution. Thank you very much.
I now call upon Honorable S.J. Manzini.
No, thank you very much, Honorable Speaker. Let's welcome all the input made by honorable members. We take all the input that are going to assist us as a department, but also we know that before honorable members come here, they prepare a speech. So it's very difficult to debate with a speech that has been written before the MEC has presented the budget. I like Honorable Nkosi. He heard that before he came here, he wrote that I want to tell the MEC to pay contractors within 30 days. But upon hearing the MEC delivering a speech, he therefore edited. And say national target, Department of Health, where are you? Is there? And what is good is that whatever target, you don't come here and report on your own. There is separate bodies that will come to the department. And those bodies, the Honorable Speaker, are telling us that as a province of Mpumalanga, in terms of the death of the province, which is called inpatient crude death, we are at 4.5%. You know where is national? National is at 12.3. Department of Health, there's nothing to argue. Because you have got the facts, the target there, they speak for itself. I've been here for 7 years. Thank you very much, because it shows that the good work that I'm doing is there on paper. To say, since you came in, how far are our people living in the I always tell people when I go out and I do, you say you must do something in terms of preventative. I have said I'm inviting everyone to a program of Cheka Impilo. What is Cheka Impilo? Each and every person must at least after 3 months or go and visit your clinics and make sure that you check out Impilo so that we can be able to deal with the issue of the Department of Health and for you to live long. And maybe sometimes you're one of our target. You know, I'll check Impilo. The next thing you'll die before the age of 70 and you'll say that we are not working as a Department of Health. So these are clear things that we're expected to do. Hey, we know in the department we have a problem. A serious problem, because instead of going to the rural, the people of the community and educate them about the different levels of care, you will hear honorable members saying, I went to a clinic, I got a Panado. Yes, Vela, you'll get a Panado. What else do you want to get? Because that is prescribed by National to say painkillers. That must be at the clinic, a Panado Vele. Why? It's a primary health care. If we give you those medications that will delay you to go to the national care, because if you want us to give you those medications that are prescribed by doctors, it means you are in the wrong place. It is prescribed. These are the painkillers. That must, one person came to me and said, MEC, I went to a clinic, I was looking for injection for pain, I did not get it. I said, you won't get it then. A clinic, uzotoli Panado. But I'm inviting honorable members. Honorable members, please, as and when you must familiarize yourself with these different fears. Ngoba omunye uzokutshela ukuthi ematikwana asikho specialists enjani. Asikho vele is a district hospital. These are different levels of care, not by MEC of Mpumalanga, but the National Department of Health prescribe.
That concludes the debate on budget vote 10. Now the question before the House is whether we agree to adopt the report.
Agree.
By Honorable Mhlongo. Agree to.
Ignore us, Speaker.
There's no point of order because there's no speaker
The speaker
in the
was
podium.
on the platform.
There was no speaker
There was
in
a
the platform.
speaker. She was still there before she concluded.
Honorable Sidibe.
Mtoli Panado, Mtoli, it's fine.
Honorable Sidibe, there's no point of order here.
I was not rising on a point of order.
Yes, but there's nothing that you can talk to because there's no speaker there.
There's nothing anymore because the speaker has left. But I raised my hand when the speaker was there.
In budget speech on vote 6, Department of Economic Development and Tourism.
I now call upon the MEC for Economic Development and Tourism, Honorable Jay Seidel, to deliver the policy and budget speech.
Thank you very much, Honorable Speaker, Ms. Makosazana Masilela, Honorable Deputy Speaker, Mr. Masango Sem, Honorable Premier in his absentia, Mr. Mandla Ndlovu, Honorable Chief Whip of the Majority Party, Ms. Eva Makabane, colleagues in the Executive, Chairperson of the Portfolio Committee of Economic Development and Tourism, Honorable Mbuyane, together with all the Portfolio Committee members, members of the Provincial Legislature, Chairperson, who is also the President of the governing party in the province, that is the African National Congress, organized labor, private sector partners, the people of our beautiful province, the province of the rising sun, Mpumalanga, esteemed guests, members of the media, ladies and gentlemen, Lishonile, Sanbonani. Madam Speaker, I am humbled and honored to present the policy and budget speech for Vote 6 before this august House during a significant month in the calendar of South Africa. As we are called upon by the United Nations General Assembly to celebrate and honor the selfless contribution to humanity by our former president, Isitwalandwe, Tate Nelson Mandela. This is my maiden policy and budget speech since my appointment as a member of the Executive Council responsible for economic development and tourism in our province. It is indeed a humbling experience, and I commit without reservations to serve the people of Mpumalanga, the place of the rising sun, with great sense of humility. Honorable members, I believe this is an opportune moment for me to extend my profound appreciation to my predecessor, who is now the Honorable Speaker of this legislature, Honorable Makosazana Masilela, for steering the leadership with zoom and zeal. We commit to continue to build on the work and achievements that have been recorded under her leadership. I therefore stand before this august House to reassure our people that as the department, we remain committed to continue to address their aspirations as clearly expressed in the manifesto of our governing party in the province, that is that of our liberation and towards creating a better life for the people of this great province. His name will forever be engraved in the history books of eternity. At the same time, we bow our heads in remembrance of Comrade Veli Mahlangu and Bishop Simon Dingaan Gumbi, who both have contributed significantly to the politics and spiritual upliftment of our people, respectively. Comrade Mahlangu was a towering figure with a rich history both in the football and political fraternity. May their souls continue to rest in eternal peace. Honorable Speaker, we also present our policy and budget speech when our liberation movement, which is the African National Congress, is commemorating 70 years of the adoption of the Freedom Charter. Even after 70 years, the Freedom Charter remains more relevant as a guiding document towards our pursuit to build a better province and a better South Africa. According to the ANC, which has declared 2025 as the year of the Freedom Charter and reaffirms its commitment to the principles as espoused in the Charter, we are alive to the fact that we proceed with the understanding that the present-day South Africa is continuing product of heroic struggles waged against the colonialism and apartheid. The National Democratic Revolution is our strategy to bring about fundamental social change. Its core social outcome is the creation of a non-racial, non-sexist, democratic and prosperous country in line with the provisions of the Freedom Charter. Madam Speaker, there is an interplay between the country's demographics. restructuring the economy in order to increase the asset base of our majority. Madam Speaker, step by step, we are journeying towards the attainment of the National Democratic Society. Madam Speaker, this requires the mobilization and direction of increased levels of investment. Honorable members, in the 2025 State of the Nation address, His Excellency, the President, Matamela Cyril Ramaphosa, reminded us of our utmost urgent task of growing the economy, creating jobs, reducing poverty, and improving the lives of our people. Equally so, Honorable Premier Mr. Mandla Ndlovu has also directed us to accelerate the implementation of catalytic projects which are geared towards the realization of inclusive growth and massive job creation. We are amongst others, as a department, directed to host the Mining Indaba and Investment Summit, finalize the feasibility studies for our Maripskop, Mountain Cable Car, and Hazelview waterways, operationalize the Nkomasi SEZ, support tourism development and product offerings in the various nature reserves, continue to develop nature and support our MSMEs, finalize the petrochemical and forestry industrial parks, and also support the economic infrastructure projects, also conduct the feasibility study on the 4th casino license, and lastly, establish training and incubation programs to enhance skills development. Honorable Speaker, I can, therefore, without any fear of contradiction, indicate that if we can fully implement all these catalytic projects, we will surely be able to grow the economy and uproot the scourge of unemployment which continues to bedevil our people, particularly the youth. We do possess the analytic capacity to mobilize private capital to take up a leading role in such sectors of the economy that they should better manage and innovate in. We will endeavor, as far as possible, to invest in human capital development, as alluded above, as well as economic infrastructure. It calls upon all of us to be dedicated in thinking. Honorable Speaker, around the Mpumalanga's economic landscape and outlook, before I present the progress we have made in steering economic development activities in the province in our interventions for the 2025-2026 financial year, let me begin by laying a foundation through an economic landscape and outlook. The world's economy is currently experiencing extreme levels of uncertainty. This is triggered by a combination of higher trade barriers plus elevated global uncertainty, especially in the Middle East, which are likely to weaken the world's economy. Accordingly, there is no doubt that this geopolitical risk will also have a negative impact on the national and provincial economy. This has led to the International Monetary Fund cutting its 2025 economic growth forecast for South Africa to just 1% of the year. Mpumalanga's growth is also predicted to be very much in line with national government and national growth expectations. In the latest economic performance report, both South Africa and Mpumalanga unfortunately did not perform well in Q1 of 2025. Key industries like mining, manufacturing, electricity, construction, as well as community services recorded negative growth rates between January and March 2025. On a positive note, therefore, agriculture, transport, and the communication industry performed exceptionally well, Honorable Speaker. Consequently, Mpumalanga recorded a net job loss of around 43,000 in the first quarter of 2025, with the majority of the job losses being in the informal sector. South Africa as a whole recorded a net job loss of almost 300,000 during the same period. To improve our economic performance, we must therefore work together to identify and explore new sustainable export opportunities and markets over the medium and long term, especially in the African continental free trade area and in the BRICS plus countries context. In our quest to reduce unemployment significantly to 25% by 2030, our province must create at least 60,000 new sustainable jobs per annum. This means we must at least increase our growth rate to 3% per annum. We will thus target industries with high potential for job creation, such as agriculture, agro-processing, manufacturing, construction, the trade industry, tourism, micro, small, and medium enterprises, including the informal sector and finance. Honourable Speaker, around us growing the economy through the reindustrialization and localization, when we stood before this august House last year, we submitted that if we are to change the economic landscape of the province for the better, we must focus on the reindustrializing the provincial economy. We further pointed out that as a province, we have already put in place an industrial development plan that is geared towards guiding the implementation of the reindustrialization program. One such intervention program is the Nkomasi SEZ. This massive catalytic project would be a game changer in the economic growth and job creation. It will undoubtedly contribute significantly in growing the agricultural sector, increase export volumes, and unlock value chains and value-add opportunities, especially for the small businesses and black industrialists. However, given the massive nature of the project, it is implemented in 4 phases, I must indicate, Honourable Speaker: the designation phase, the interim phase, the developmental phase, and the operations phase. As I speak, we are now currently implementing the 2nd phase of the project, which is the interim phase. In essence, this is a phase where issues of detailed planning are being addressed. Yes, it is a phase where we have to ensure, inter alia, that a well-oiled and fit-for-purpose SEZ entity is established. All the statutory requirements are fully complied with. The township is established and registered with the Office of the Surveyor General. All the necessary licenses, such as water use and the environmental authorization, are obtained. And all the detailed engineering designs of bulk infrastructure and internal services are towards completion. To date, we must, Honourable Speaker, report that we have managed to appoint a full-term board of the SEZ entity in November 2024, and also appointed the Chief Executive Officer. Parallel to the activity of the detailed engineering designs, the department is also working with the Infrastructure South Africa in the presidency to bring the current business plan of the SEZ entity into a bankability level. The entity has managed to establish an investment pipeline of 14 potential investors. 4 of the 14 potential investors are almost ready to locate into the SEZ, Honourable Speaker. However, this is dependent on the availability of the appropriate bulk infrastructure and internal services that would require a 2 billion. The Department of Trade, Industry and Competition, in collaboration with our department, are currently also looking at the possibility of positioning the Nkomasi SEZ as a cross-border SEZ, an objective that is in line with the 2063 Southern African Development Community industrialization strategy and roadmap, whose primary goal is to foster intra-Africa trade, particularly amongst the 16 member states of SADC. This will promote and deepen regional integration, cooperation, and economic development. In line with the directive by the Honourable Premier, as it relates to fast-tracking of the establishment of catalytic projects, such as the Petrochemical Industrial Park in the Government-Beki local municipality, we can report that we have finally received Section 53 approvals in terms of the Mineral Petroleum Resources Development Act of 28 of 2002. This will now enable the department to ensure that the necessary conveyancing is completed to open the township register that will conclude the planning phase of this development. Our province also offers many opportunities to micro, small, and medium enterprises in infrastructure development, notably through initiatives like the Nkomasi SEZ, as I've mentioned, and also the Mpumalanga International Food Market and the industrial technology parks in all our 3 regions. Around investing in the green economy, Honourable Speaker, it is with great pride that I also reflect on the progress we have made in positioning Mpumalanga as South Africa's green growth frontier through the strategic work that the department has been doing in collaboration with the Mpumalanga Green Cluster Agency. Our province has proactively explored green economy opportunities through a cluster development model, engaging government, business, and the academia to drive sustainable growth. This entails removing barriers to development, such as assisting developers to obtain authorizations required for utility-scale projects to reach the final close. And notwithstanding the undisputed fact that Mpumalanga remains the country's coal-generated electricity powerhouse, we must be amenable to adopt new technology as an additional source of energy. In our last debate, many ideas came out, which as a department, together with this relevant agency, we are going to explore. Accordingly, we commit to adopt green energy to supplement coal-generated energy in our quest to even save jobs, which are currently being threatened. During our last appearance, we highlighted some of the high-impact projects in the green economy space, some of which were also mentioned by the Honourable Project, will bolster the nation's energy security by increasing generation capacity, contribution to job creation, and as we speak, construction has commenced with over 1,000 jobs created. Madam Speaker, I am pleased to announce that the first wind turbine has been erected towering the town of Bethal, standing at 221 meters tall, demonstrating an engineering excellency and significant milestone in South Africa's renewable energy journey. We are proud as DDET and the MGCA family for the contribution we have made to enable this investment in our province. The carbon capture utilization and storage project was launched by the Honourable Premier and the Minister of Minerals and Petroleum Resources in Leandra in 2024. The project is South Africa's first carbon capture utilization and storage research site. South Africa's cooperation with the government of the Netherlands has resulted in the construction of a high-tech horticulture demonstration center, which will serve as a training facility and incubation center. The facility repurposing sites in the province. Engagements through DDET, the DADLEA, and MGCA has resulted to mining houses agreeing to release rehabilitated land for repurposing. Seriti and Tugela mining companies are willing to immediately release approximately 15,000 hectares of rehabilitated land with a propensity to release more. The land is ideal for agriculture, nature-based solutions, and recreational use. The department is already engaging the private sector for initiatives that will create employment through productive usage of rehabilitated land. Madam Speaker, these catalytic projects will not only contribute to economic growth in the province, but will also create the greener job opportunities, as well as assist in mitigating the impact of climate change and ultimately setting the province on a path of driving a low-carbon economy. The department, in partnership with MGCA, will thus continue to lead in innovative approaches to convert environmental challenges into developmental assets. The achievements we have already recorded in the past year are just the beginning of a brighter, more sustainable future for Mpumalanga, Honourable Speaker. With an unwavering commitment to a just transition, green economy and job creation, we are shaping a prosperous future for our citizens. In terms of reigniting tourism, the province biodiversity gold mine, honourable members, tourism remains a priority sector in Mpumalanga, with much potential to create the much-needed jobs. In this regard, our department will continue to support strategic tourism initiatives that market the Mpumalanga province as a tourism destination of choice. As directed by the Honourable Premier, we are moving towards realizing tourism growth game-changer projects in partnership with the private sector. In this regard, we have advertised bids to do feasibility studies for the development of the Maripskop cable car project in Bushbuck Ridge Municipality and the waterways project around Hazelview in the city of Mbombela Local Municipality. The introduction of these high-impact tourism projects to the existing tourism product offerings will surely increase the tourist length of stay and tourism spend. Honourable members, the development of the Barberton-Makonjwa Mountains World Heritage Site remains the department's priority. However, I must indicate that the existing impasse between the private landowners and MTPA on the development of the site is a cause of concern, which as a department we need to address as a matter of urgency. Whilst the parties are engaging to settle their differences out of court to cap the already high legal costs and the developments that was halted, the department is initiating engagements with the South African Heritage Resource Agency and the South Africa Heritage Council for further interventions. The department also acknowledges the concerns raised by the tourism industry stakeholders about the poor condition of some of our tourism attraction sites, particularly the panorama route in the Blythe River Canyon, which has a high volume of tourist members. Accordingly, the MTPA has started to fix some of these amenities to return them to their normal functionality and appearance, whilst planning to increase the capacity of existing capital assets in the medium term. The entity is also seized with the upgrade of all other aging infrastructure in the nature reserves. To leverage on the expertise and financial capacity of the private sector, the department through MTPA is outsourcing most hospitality tourism facilities to our provincial nature reserves, which require a significant capital investment, such as the Zitabisen Resort and the conference facility at the Mabusa Nature Reserve and the Humala Lodge in Songimvela Nature Reserve, to mention just a few, Honorable Speaker. The revitalization of these tourism facilities will stimulate the domestic travel market, and since these facilities have been in the market for a while now, the MTPA has adopted a targeted marketing strategy by approaching prominent players in the tourism industry to invest in these business opportunities. Madam Speaker, the safety of our tourists on our roads and facilities remains high on our priority list, Honorable MEC Public Works. Accordingly, the MTPA, with the tourism industry stakeholders, the South African National Road Agency, municipalities, departments, community structures, and the law enforcement agencies continuously hold meetings to discuss and improve tourism safety strategies. Furthermore, these tourists who are victims of crime are given assistance through victim support programs, and we have moved also a step further in terms of working with our sister department that Honorable Masia is responsible for. Let us further commend the municipalities and the Department of Public Works, Roads and Transport for completing the rehabilitation of some of the key tourism roads in the province. For example, the Belfast Mashishini thus accounting for the 23.8% share of international tourist arrivals to South Africa. The province received 2.1 million international tourist arrivals, which represented an increase of 15.6% compared to 2023. However, the spend by the international tourists remains low at 7.5 billion rands due to, amongst others, limited or outdated tourism product offerings. So we need to think outside the box and be innovative in terms of the product offerings. On the other hand, we are not doing so well in terms of domestic trips, as a province generated only 3.2 million domestic trips and is rated number 5 in terms of the domestic trips. As we continue to promote domestic tourism, I encourage all South Africans to visit Mpumalanga's tourist attraction sites to explore and experience the diverse tourism product offerings and continue to be the ambassadors of our own tourism and investment destination. In terms of strengthening support to small business development, Madam Speaker, the Mpumalanga Economic Growth and Development Path, our economic blueprint, enjoins us to place muscle behind our intention to support and develop micro, small, and medium-term enterprises. Therefore, the department is in partnership with the private sector and will continue to strengthen and support small enterprises, particularly those found in the rural areas where I come from. We believe that micro, small, and medium enterprises are the backbone of our economy. Accordingly, If this sector is supported meaningfully so, we will be able to grow the economy, create the much needed jobs for our people, and dismantle the stubborn triple challenges of poverty, unemployment, and inequality. To this end, during the previous financial year, the department managed to support municipalities in the green economy initiatives to ensure access to landfill sites by MSMEs and cooperatives. This support was provided to ensure that small enterprises gain access to the waste to promote the recycling of waste products with a view to create the much needed jobs. In addition, as part of our continued support to MSMEs, we provided equipment, tools of trade, and aftercare services to women and youth-owned businesses in the textile, automotive sector, and green economy, particularly in the townships and the rural areas. Amongst others, we have been able to support businesses such as car washes, hair salons, spaza shops, and manufacturing businesses. Through this economic empowerment program, we were able to support more than 50 small enterprises. Among the previous financial year, MEGA also provided financial support to SMMEs to the tune of 41,936,850 rands to 76 businesses across the province. Of this, a total of 39,290,000 rand was disbursed through the Premier's Youth Development Fund, wherein 76 youth-owned businesses were funded. MEGA has also continued with its program to revitalize 3 of the industrial parks, namely Kapokweni, Siabuswa, and Enkandastria. The entity will, in the current financial year, continue with building condition assessments to determine the value and revitalization work to be carried out, which will then be followed by the implementation of the renovation and revitalization program. We can also report that the occupancy rate at MEGA's 15 small industrial parks with a total of 303 factory units is now at 60%, with 367 jobs created. In relation to the Enkandastra Industrial Park, the occupancy rate is at 72%, with 1,795 jobs created as of September 2024. The Siabusa Industrial Park has a total of 28 factory units and is now sitting at 61% occupancy rate, which is having 136 jobs created. With regard to the Kapokweni Industrial Park, which has 44 factory units, is now sitting at the occupancy rate of 75%, with 697 jobs created. Honorable members, in the current financial year, MEGA will continue to assist the previously disadvantaged individuals within the province with access to housing loans, especially those that are within the housing market gap, earning too much to qualify for government subsidized housing, but not enough to afford houses or homes in the open market. To this end, the entity has allocated 30 million rands towards housing loan disbursements. MEGA will also provide financial support to import, reporting guidance and advice on access to market. Madam Speaker, for our economy investment, hence we will host the investment summit during the current financial year to solicit investment pledges from the private sector. Additionally, the department will also host a mining indaba to address the question of transformation in this important sector, especially focusing on opening opportunities for artisans and junior miners through mine rehabilitation. The indaba will also focus on the interventions such as incubation, skills development, and address other barriers of entry into the sector. Strengthening support to our MSMEs with a bias to those owned by youth and women remains on our radar, or rather screen. Hence, we continue to partner with governments, development finance institutions, training and skills development institutions such as the SIDFA and CITAS, including the South African Bureau of Standards. This has resulted in the department in collaboration with the National Youth Development Agency dispersing funding with 3.5 million rands to 23 tourism youth businesses in Mpumalanga. The fund aims to empower young entrepreneurs in the tourism sector by providing financial assistance and resources to help them grow and expand their businesses. Ultimately, stimulating innovation, creating jobs, and promoting sustainable business growth, especially in the rural areas. In addition, the department will intensify its comprehensive support to MSMEs in the green economy, agro-processing, manufacturing, big business, MSMEs, and the informal sector. Support will also be provided to municipalities on local economic development in pursuit of the district development model to improve the lives of our people. Around the business, regulation and governance, Honourable Speaker, in response to the outbreak of foodborne illnesses emanating from goods bought from spaza shops, our department conducted a series of successful multidisciplinary unannounced inspections of businesses across the province. I am pleased to inform the House that we were able to inspect at least 20 shops. Unfortunately, out of the 20 shops we inspected, only 12 of these shops had trading licenses. Consequently, Home Affairs immigration officers arrested one foreign national.
Take your seat, Honorable Mkabela.
Honorable Speaker, my concern is that all ANC members are busy on their phones while Honorable Saidel is delivering this budget vote. It's wrong and it's wrong. They must correct it.
Honorable Mkabela, you must raise a point of order. That is not a point of order. Honorable MEC, can you please proceed?
Thank you very much, Honorable Speaker. Our department will further continue with a sustained campaign on multidisciplinary enforcement interventions and awareness campaign while also providing training to the business owners. Honourable members, as previously committed, the Mpumalanga Economic Regulator successfully hosted the inaugural provincial Liquor Indaba in September last year. This key stakeholder engagement brought together industry players, government departments, law enforcement agencies, and community representatives to strengthen collaboration and address the harmful effects of alcohol abuse. The Indaba laid a firm foundation for policy alignment, enhanced enforcement, and shared responsibility in tackling liquor-related social harm. A key outcome was the resolution for MER to intensify joint action was taken against 747 non-compliant outlets, resulting to 623 closures, 38 suspensions, 6 formal warnings, and 80 remedial cases. As we advance into 2025-2026 financial year, we are confident that strengthened enforcement and sustained partnerships will lead to improved compliance with liquor laws across the province. Pertaining to the gambling industry, in response to the directive by the Honourable Premier, I wish to confirm that the feasibility study for the proposed fourth casino license in Mpumalanga has been prioritized for the current financial year. The study will reassess the market viability and identify potential geographic areas of demand. This process is critical to ensuring that any potential expansion aligns with the developmental objectives and contributes meaningfully to the local economic growth. Honourable members, during the previous financial year, our revenue collection efforts yielded remarkable success. Through the Mpumalanga Economic Regulator, we collected 1.5 billion rands in gambling and liquor license fees and taxes, representing a 70% increase from the previous financial year. This substantial growth reflects both improved compliance and the efficiency of our collection strategies. A key contributor to this growth is the Mpumalanga's proactive approach in leveraging regulatory opportunities and digital platforms. This approach has enabled gamblers from across the country and even beyond our borders to access gambling services through Mpumalanga licensed operators operating via digital platforms. As a result, the province now commands the largest market share in the digital gambling space. It is important to clarify that this does not necessarily mean that more people in Mpumalanga are gambling compared to the other provinces, nor does it suggest that we are investing more than others. Rather, it highlights the success of our licensing model and digital adoption. which have enabled our licenses to attract and serve a broader national market, expanding both our regulations reach and revenue base. As we look ahead to the new financial year, we will continue to regulate both the gambling and liquor industries effectively, while further improving revenue collection for the province. Working closely with the South African Police Service, we intensified operations against illegal gambling during the 2024-2025 financial year. Accordingly, a total of 180 illegal gambling devices. Our commitment to protecting vulnerable communities, particularly minors, from the harmful effects of illegal gambling activities. Another key milestone during the year was the completion of the Provincial Socio-Economic Impact Assessment on Gambling. The study presented several critical recommendations which have since incorporated into the MER's medium-term development plan. Amongst the key recommendations emerging from the study are the establishment of a gambling barometer to monitor emerging industry trends and behaviors, the development of the provincial responsible gambling policy, and the rollout of the community-based cooperative social investment programs. Social investment programs, rather. These initiatives are aimed at mitigating the risk associated with excessive gambling, promoting responsible behavior, and intensifying public education and awareness campaigns, particularly on issues of underage drinking, alcohol abuse, and problem gambling. We will also host the Provincial Gambling Indaba, which is a high-level platform for engagement between government, industry players, and civil society. This forum will promote shared responsibility, knowledge exchange, and the collective shaping of a responsive and inclusive gambling industry. Now, going to the last part of my policy statement, Honourable Speaker, which is around the budget allocation. Honourable Speaker, the planned targets we have just tabled require accompanying funding for them to be realized. In this regard, the 6 programs of the department are proposed to be funded as follows. Under Program 1, which is administration, it will receive an amount of 131,325,000 in order to enable effective operational support to the programs of the department and public entities. On Program 2, which talks to the integrated economic development, it will receive 385,764,000 rands. Included in this amount is 273,600,000 rands to fund the requirements of MEGA, 3 million rands from Mpumalanga Tourism Youth Fund, and 38,053,000 rands to fund the Mpumalanga International Food Market, which is around your operating of the refrigerators as well as finishing all the snack list as committed by my colleague in the morning that end of July we should be done, having concluded as Public Works has handed over these. It is just a drop in the ocean. We complete. It is just a drop in the designs to attract investors, or rather say investors are. It is just a drop in the ocean. I've indicated. It is just a drop in the ocean. I've indicated earlier on, once we complete the designs, to attract investors, or rather say investors are ready for information and other opportunities, and as well working with the SETAs in terms of information and other opportunities, and as well working with the SETAs in terms of skills development. Program 4, Business Regulation and Governance, will receive 167,461,000 rands, which includes 139,304,000 rands to fund the requirements of MER. Program 5, Economic Planning, will receive 23,720,000 rands. And lastly, Program 6, which is around tourism, we are going to allocate, or it is allocated, 518,352,000, which includes 499,461,000 rands to fund the requirements of the MTPA. The total amount to be transferred by the department to its public entities is 981,760,000 749,000 rand, which is 74% of the total budget of the department. As the executive authority of the Department of Economic Development and Tourism, I now request the House to consider and appropriate the total allocation of 1,324,261,000 rands to fund the requirements of the department, which is Vote 6, for the financial year ending March 2026. As I conclude, the Honourable Speaker, the phrase by John F. Kennedy, I quote, "Ask not what your country can do for you, ask what you can do for your country," close quote. It encourages a belief system of service and active participation in building a better life and a better nation. Madam Speaker, let me take this opportunity and extend my sincere gratitude to the African National Congress, the revolutionary movement of Oliver Reginald Tambo, for entrusting us with the task of implementing the electoral mandate during the term of the 7th administration. I also wish to extend my gratitude to the Honourable Premier, Mr. Mandla Ndlovu, for entrusting me with this responsibility and his support and guidance. My appreciation also goes to my colleagues in the Executive Council for their continued prayers for protection. And, Madam Speaker, let me end by thanking all our social partners, including organized labor, the private sector, and the people of Mpumalanga for partnering with us in this noble crusade towards inclusive economic growth.
Tourism, Vote 6, Department of Economic Development and Tourism.
I now call upon the chairperson of the Portfolio Committee on Economic Development and Tourism, Vote 6, Department of Economic Development and Tourism, Honorable L.A. Mbuyane, to table the report.
Komanisi. Sheshisa Komanisi sesifuna kuhamba.
Ngiyabonga Somlomo lothembekile. Njengasihlalo welkomiti letemnotho kuthuthukisa natekuvakasha. I'm rising to table the report as presented by the MEC for considerations. Thank you very much.
I am informed that there is no debate on this report. Now the question before the House is whether we agree to adopt the report as tabled by Honorable Mbuyane. Agreed to?
Agreed.
As so agreed. The Secretary shall read the 9th order of the day.
Order number 9, consideration of a report of the Select Committee on Rules on the repeal of the Mpumalanga Provincial Service and Administration Act 7 of 2006 and amendments of the rules and orders.
I now call upon the Deputy Speaker, Honorable S. Masango, to table the report.
Thank you very much, Speaker. I rise to table the report of the Select Committee on Rules and Repeal of the Mpumalanga Provincial Service and Administration Act number 7 of 2006 and amendment of the rules and orders as presented. Thank you. For this House to consider. Thank you, Chair.
I am informed that there is no debate on this report. Now the question before the House, and so agreed. The Secretary shall read the 10th order of the day.